Dawn Buse, a clinical professor of neurology at Einstein College of Medicine and a member of the board of directors of the American Headache Society. And I wanted to talk for a moment about the current new technologies and treatments and understanding of migraine pathophysiology we have and the exciting trajectory of the future. So, as you probably know, the past several years have really been a renaissance in both understanding of migraine pathophysiology as well as development in migraine-specific treatments. It's been a really exciting time for people living with migraine. And in fact, we've seen developments in almost all types of therapies, including acute pharmacologic treatments, preventive pharmacologic treatments, non-pharmacologic treatments such as neurostimulation, behavioral therapies such as mindfulness-based therapies, acceptance and commitment therapy, and better understandings of biofeedback and cognitive behavioral therapy, as well as really understanding more about the pathophysiology of migraine and the natural course of the disease. So migraine, we believe, has been with us since the dawn of mankind. We know that we've seen what we believe is evidence of it in Egyptian hieroglyphs, including approaches to treatment at that day and age. And in some ways, we've come a long way, and in some ways, we've circled back. In fact, very early treatments included even putting electric eels on the head for some kind of electric shock. And if we think about neurostimulation and developments in that area, we can see we've come kind of full circle. And now we're specifically targeting specific nerves, such as the vagal nerve and other nerves, the trigeminal nerve, involved in migraine through certainly more sophisticated techniques than using an electric eel. However, our understanding has come a long way, and it's been very exciting. Certainly in the acute space, we have novel therapies such as the gepants and the diazepams. In the preventive pharmacologic space, the MABs have really been wonderful options for those who weren't getting either the efficacy or tolerability of the traditional oral preventives. And the traditional oral preventives do work for a good percentage of people, but the MABs can really help those people that it doesn't work for. And those are CGRP targeted monoclonal antibodies. And there are 4 now that are available in the US, 3 which are a self-administered IM medication and 1 which is a quarterly IV medication. And these preventive medications can work quite quickly to some degree compared to the traditional oral medications, as well as a high degree of efficacy for a good percentage of people who try them. So that's very exciting. And as I mentioned, there's a lot going on in understanding of migraine pathophysiology. We're getting a better understanding of what goes on in the brain during, before, as well as in between migraine attacks. We're understanding more about the importance of something so basic, such as lifestyle, healthy habits, and regulation. We're learning from some wonderful work at the Head Priest study with Dana Turner and Tim Houle about what might be triggers, and they're actually quite fewer than we might have thought. And what it looks like is consistency is key for the migraine nervous system. Maintaining a regular sleep-wake schedule 7 days a week, regular diet and nutrition, staying hydrated and eating on a regular schedule, managing stress, a reminder that we can't stop the waves from coming, but we can learn how to surf, like John Kabat-Zinn says, teaching our patients to manage the stress that they experience. Social support and regular exercise or movement all seem to have great benefit to the nervous system and the brain of someone living with migraine. So we're understanding more and more every day in all of these areas, and it's driving therapies, be they pharmacologic or non-pharmacologic, so that we can really get good treatment to people living with migraine. We know that from the Global Burden of Disease study, about 1 billion people, billion with a B, around the planet meet criteria for migraine. That's about 40 million Americans who meet criteria for migraine. But we know from several of our large epidemiologic studies, only about half of them, maybe 60% more recently, seek medical care. So we need to continue to put major efforts towards educating the population, as well as destigmatizing migraine and increasing migraine research, so that we can continue to get more of the people living with migraine to medical care, as well as to the non-medical care, such as learning about these important lifestyle habits and the important self-care techniques. But a lot has happened in the migraine space. And if you're someone who lives with migraine or someone who cares for people who live with migraine, this is exciting times, and there is more good news on the horizon. So keep watching this space.